ROP is a disease of newborns, and fortunately or unfortunately, the doctor's children are also getting affected. Their nephews, nieces are getting affected. So this is not just for public, but it is for ourselves. Even today, I am treating a doctor's child who has already got, stage 5 ROP and was not screened. So this disease is something which is very close to doctors' community as it is to others. These children are not born blind, but they become blind very soon after birth, and it's a silent disease. So a timely eye examination is the only way to detect and treat this on time. And if we treat on time, then they become okay. So what is important is to know that, these incubators, they started on the Coney Island. These were the, hatcheries in which eggs used to be hatched. And Dr. Coney started putting babies in them to save their lives. And the first incubators took so many years to reach the Boston Children's Hospital. But once the child was in Boston Children's Hospital in 1941, the first ROP blind was seen there in 1942. So we know for almost 80 years that if you have an incubator anywhere in the world, within a year, you will start seeing blind children there. And, we are screening such tiny, tiny babies. Now we are saving great work by the neonatologists, nurses. We are saving, 375-gram babies in India. So India is no longer immune to, it's not a disease of the West. It's very much a disease of ours. So ideally, it should be the neonatologist who should be going around trying to identify who is going to screen my baby, who I am going to save in my NICU, and they should take the ownership. Just like polio program cannot be owned by neurologists and orthopedicians. It has to be owned by child care specialists. So why should ROP be owned by eye specialists and not by the pediatrician? But this is what is happening, that we are going around searching these babies, trying to find out where are the incubators. Now Google has helped us. Previously, I had to go door to door to find these incubators. And then we are trying to screen. Everybody should follow the RBSK guidelines. There should be no other guideline which we follow. This book is available on the RBSK website free of cost. And we all should follow the universal screening and the ROP screening, both the newborn eye screening, anti-segment, red glow, and the ROP screening. And what has happened in the country is that now almost 25 to 28% babies are coming from smaller places, from places like Bankura, places like Gorakhpur. Hundreds of babies are coming from there. Previously, they were coming only from the metros. So the disease has now spread into rural India because more than 800 NICU, or what I call as SCNU, set up by Government of India in the government sector and many more in the private sector. So, millions of babies are now being saved. Those used to die. And so we are seeing this change at LV Prasad and at every place that more and more babies are coming. 30 din Roshni ke is the mantra. You can sleep through the whole presentation. Just remember, if your friend or your nephew, somebody has delivered a preterm baby, get its retina checked not later than 30 days. And that is, the prediction requires very good nursing. Requires pulse oximetry and blenders and very good nursing care. By monitoring the oxygen, then we can reduce. But we are not going to get nurses so easily. We are all short of nurses. So we are still going to see a lot of ROP till we are able to give high quality care to these infants. I warn everybody that please don't do screening or treatment without proper training. People have missed very severe ROP because they were not trained. It should not be done without training. But still, with everything being there, we are seeing a lot of blind children. And even in COVID times, we have not stopped the thing. We decided that this was a very important part of care, and we were at it all the time. And what is our dream is that in our 3 states, we are not going to have any blind baby. So we are working with government and NGOs to correct everything. What is required from the ECOIN member, the last slide, is that please, when you are doing your community eye health, you are doing glaucoma camp or cataract camp or any camp, isolate yourself from the whole health structure. And the newborn babies require your attention as much as the old person with cataract or glaucoma is requiring. So please put up a poster or put up a health message in your area so that the ASHA workers, the health people, at least they know that newborn patient needs a screening. 30 din Roshni ke. Thank you so much, and I'm always available for any suggestions or any mass campaign or any initiative in the field of newborn blindness and ROP. Thank you.